because last time we talked about dandruff, and we discussed how eczema and psoriasis were difficult sometimes to differentiate from just your standard dandruff, which we said was seborrheic dermatitis. So we thought it might be appropriate to actually talk about, just go into dandruff a little bit more. That seemed to be a topic that a lot of people were interested in discussing, because it seems to be one of the probably the biggest problem that people suffer when it comes to trichology. So we are going to give you guys what it is you want. Make sure that you ask your questions.
Send the questions,
Send your questions under Leeds Private Trichology Clinic. This page, you'll see this video on other pages, but if you want us to reply straight away, make sure that you ask on Leeds Private Trichology Clinic, the Facebook page, right under this video, and we are more interested in hearing from you than hearing from ourselves. We'd rather hear what you guys have to say rather than just us talking at you for 30 minutes. So please, this is supposed to be interactive. This is really about answering your questions more than just giving you information. So make sure that you interact. Thank you for everybody that is joining us right now. I can see there's a lot of people tuning in, so I'm just going to give it a couple more minutes.
Okay, yes, it is. It's actually quite very interesting, because psoriasis and eczema, psoriasis, eczema, and seborrheic dermatitis, they're very, very similar. Even when diagnosing it in the clinic, they're very close together. That you have to know exactly which one is which. So it's a very interesting subject, because we are going to go quite in depth with it, just giving you giving you the right information of knowing exactly which one you can tell this is psoriasis, this is eczema, what exactly are the differences between the two. So it's quite interesting.
Yeah, I'm really excited myself. So I am a medical student with an interest in dermatology. So I'm really interested in having, looking into your mind and kind of knowing
from the trichological
side. Just to for those of you who are new to our channel, who are new to trichology, can you kind of just tell us again what trichology is?
Okay, trichology is when you think of hair and you think of hairdressing, that's quite common. Everybody knows about hair. Most people knows about hairdressing. That's the side of like styling, a skill that they practice in. But when you go towards the trichological side, it's like kind of like tilting the medical side. So it's a specialist branch of dermatology, which focuses on issues of scalp diseases and the hair loss problems. And a trichologist itself is a certified practitioner that can diagnose and treat according to cause. Yes, this is who I am. I did my 4-year degree in London, and I completed and launched my clinic in Leeds, Trichology Clinic. So it's quite interesting. I love what I do. It's very, very interesting.
Yeah. Amazing. I recently did a module in a little bit of like the physiology
in your medical sciences.
Yeah, the physiology of dermatology a little bit, going back into what is the skin, how is it formed. We actually spent a long time on hair follicles. And I know that we're going to pathology, which we'll be doing in the future. I know that a lot of the things that you discuss and which you might meet in your trichology clinic, I know they're going to come up. So yeah, I think you're 100% right about it being, more in the medical side as opposed to in the hairdressing.
Yeah, because the first year of trichology, you do the integumentary system of the, the skin, which is like the integumentary system, the skin, the hair, and the nails. So that's what you do, and which also you will do the endocrine system, you do the skeletal system, you do the, the muscular system. renal, everything. You do everything to do with the body, because you need to know how the body operates, how the body functions. So that's more of it, because the hair is connected to your body. Hair is part of you. Hair is made of cells. It's from the cells. It's from also the amino acids that also are the ones that actually in the collagen side that makes the most of the bones, the bone structure, the tissues and everything. So that's the same thing that makes hair too, and skin and nails.
This is
very
really
interesting.
Recently I was because I know you said that whatever's in the body is can be, or the hair is a really good tool for figuring out what is going wrong in the body.
Right.
And I was actually watching, I think, NCIS or something.
Okay.
These criminology programs.
Okay.
And sometimes they discuss hair within forensic science. And I think that just reiterates your point that the hair is such a good diagnostic tool. And we in the healthcare profession, that skin is an amazing diagnostic tool. But the hair is just an extension of that. It's part of the integumentary system. We know that nails are an amazing diagnostic tool. People focus on hair and nails. So people focus on skin and they focus on nails. But they also, perhaps the hair part of it gets a little bit lost. Hair loss, the quality of hair, the sort of the biochemistry of the hair is all involved in telling you what's going wrong. For example, if the person is a drug addict, you can tell with
everything,
the hair.
yes.
So it's used in criminology, it's used in court, and it's used, or it should be more perhaps thought about in the medical profession. But so I'm really excited. I think this stuff is interesting. We will go into forensic a little bit one of these days.
One of these days.
Yes. But for now we're gonna
go into trichology. Psoriasis. Psoriasis. From the side of the trichological side. So most of you have come across or you have heard about psoriasis. Psoriasis, I would say it affects between 2 and 5% in the whole world. And psoriasis is a skin condition, and it's a 29% of psoriasis affects the scalp part of the body, the scalp.
79%.
79%, yes. It's mainly the scalp.
So 79% of the type of the
psoriasis, we call that type the vulgaris one. Vulgaris one, it's kind of like affects the scalp.
Wow, so you might not have psoriasis on your body, but sometimes you have it on your
and people could mistaken it with dandruff and thinking it's dandruff when it's actually psoriasis.
Wow. So that's really interesting. So why do you think sometimes, or most of the time, 79% of the time, is relegated to the scalp and not the rest of the skin?
Psoriasis in itself, to be honest with you, I mean, if you know that the same way people can differentiate it a lot with other conditions like eczema and seborrheic dermatitis, which is dandruff. If going back late 18th century, that's when they managed to differentiate psoriasis from leprosy.
Wow.
So psoriasis were actually they were thinking it's the same as leprosy. And as you know, leprosy is caused by a bacteria. You are in the medical side, you should know that, right?
I think it's Mycobacterium leprae.
Yes, exactly. Yes. So that's what causes a leprosy. But there was a time when psoriasis was actually thought to be part of leprosy.
Wow.
But when we come into psoriasis itself, psoriasis is a skin condition that is not contagious.
Okay.
And also, it is more like a condition that is a hyperactive of the growth of cells.
Okay.
hyperactive, growth of cells. So
it's
this
the hyperactive growth of cells.
Cells.
It's not leprosy.
It's not leprosy.
Right.
So it's an autoimmune disease, an inflammatory autoimmune disease.
Right. So the cause is not bacteria. It's not an infectious
It's not
agent.
bacteria, but the cause still is not yet known. The real cause for it. Yeah, it's not known, but it is actually an inflammatory immune condition.
So we don't know what causes the body to then
to